Mental health has only a small correlation with mass violence, but experts say we should still pay close attention to its effects and warning signs to reduce the risk of violence. For individuals, one of the best ways to improve this understanding is with mental health first aid training.
They ought to learn a little bit about some of these major mental disorders that we're talking about. Nobody's envisioning that they need to intervene themselves, that they need to treat it. They need to know, though, that if it's a dangerous situation, and that by that I mean the individual isn't bringing risk to them, but risk to him or herself, they need to know how they can safely stabilize the situation and then mobilize resources.
Researcher Anthony Jorm and nurse Betty Kitchener started mental health first aid in Australia in 2001. Jorm told Newsy they used controlled trials and scientific research to settle on training that would help adults understand mental illness and crisis.
Some recent research we've done in Australia found that one of the major effects is that people are more willing to talk openly about suicidal feelings after doing mental health first aid training.
The training isn't like a CPR class. Students aren't learning linear, concrete skills to perform on a mannequin. Instead, they run through simulations. They talk through different ways anxiety or depression presents itself.
What is a mental health disorder? What do we mean when we talk about that or when we say that phrase?
They decipher the impact that various physical and mental illnesses have on a patient's life. And they experience what it would be like to hear voices while you're trying to concentrate on something else.
You still live in the area?
Why is he looking at you?
Pretty close. I mean,
Is he looking at you?
If you have these activities like, the hearing voices, you can realize how hard it is for somebody to concentrate, how disruptive this is and how distressing it could be for a person.
This class is meant for anyone. Some people take it so they can be there for their friends and family. Others use what they've learned to help patients every day.
I have family members and friends who go through these mental illnesses and suicidal tendencies and things like that, and it's nice to feel like there's a concrete way to address it, and it's flexible enough that you can take person by person and sort of figure out what to do from there.
We get out into actual 911 and running these calls, and what we quickly realize is that mental health plays a significant role as a primary cause of many of the calls that we go on. But in addition to that, it also plays a sort of complementary component to many of the calls we go on.
The National Council for Behavioral Health says more than 325,000 Americans have gone through one of these day-long trainings in 2019. Nearly 60,000 of them have come from specialized audiences like higher education professionals, veterans, or rural communities. But in almost every state, only about 1% or less of the population overall has taken a mental health first aid course. Experts and advocates hope more people sign up. Are you happy with the turnout? Do you feel like more needs to happen?
Well, I think everybody should take this course, honestly. I could absolutely see it being beneficial as sort of like a required course for high school. So yeah, I absolutely think more people could take the course and benefit from it.